What's up, guys? It's Dr. Jim. I am your CBD expert, your natural health care expert, and your worldwide virtual health coach. And I want to welcome you to tonight's live. So tonight's topic is CBD oil and heart disease, right? So that's it's an important topic. I've gotten a lot of questions about it, and I just thought, what better time to talk about it than right now? There's a lot of people that want to know this information. So the title tonight is CBD oil and heart disease, all right? So when you're getting on tonight, if you wouldn't mind just putting in, put in your name, well, although I think it includes that, but put in where you're coming in from, and whether you're watching it live, because I gotta know. Are you getting the full energy of Dr. Jim live, gonna give myself a heart attack, or are you watching it on the replay? But either way, I know tonight is gonna be awesome because this information is important. This is a big deal. This changes people's lives, and I think everybody wants to know about it. So thanks for getting on. Once again, live or on the replay, but let's get into it. Tonight's topic is CBD oil and heart disease. Now, before we get too far into it, there's a big disclaimer, and the disclaimer is really important tonight, all right? So, number one is I am not your doctor tonight. You are not my patient tonight. There is absolutely nothing about this video that constitutes a doctor-patient relationship. Please do not change anything, especially when you're dealing with the heart and heart medicines or anything like that. Please do not change anything about your current medical treatment just because you heard me talk about something cool in this video. Number two is CBD oil is a natural supplement. It is not a drug. So it is not for the treatment or cure of any specific disease or condition. However, what I like people to understand is that CBD oil can have a positive impact in many areas of your health, and that includes your heart. So that's why tonight's topic is CBD oil and heart disease. Now, why is heart disease so important? Well, number one, heart disease, cardiovascular disease, is the number one killer globally for like nearly 20 years now, all right? Did you get that? Like, cardiovascular disease is the number one killer worldwide. So all of my people that are coming live from other parts of the world, it affects you just as much as it does us here in America. All right? So cardiovascular disease is the number one killer globally for nearly 20 years. And here's the interesting part about that is that heart disease is pretty much a preventable condition. All right? So think about that. The number one thing that kills us is actually a preventable condition, meaning it's not like, it is often lifestyle related. So if there are some things that we could do lifestyle that could change the outcome, wouldn't that be awesome, right? Well, here's the problem, and part of the problem with it is we've been fed this belief that the problem or the main cause of heart disease is cholesterol. Right? Isn't that what everyone's been taught? Why, when you go to the doctor and they check your blood work, what are they really looking for? They're almost always wanting to look at your cholesterol number. And what we've been doing and what the medical community has been doing has been telling you wrong information. They've been pushing this idea that cholesterol is the cause of heart attacks. Now, this is where they got that from. Person has a heart attack. They go in and they cut the artery open, and guess what? It's clogged full of cholesterol. So they get there and they go, oh, all this cholesterol is clogging the artery. Cholesterol, therefore, is the problem. Well, here's the thing. That's like saying that, so if you had a dumpster out back and rats showed up, that would be like saying that rats cause dumpsters. Right? It's the reverse, Like cholesterol showed up because of something. And what the most recent research has shown, which is really crazy, is that your diet, so we went on this witch hunt, and the whole goal was to remove cholesterol from everything. No cholesterol, quit eating eggs, don't eat butter, eat margarine, all of this wrong information. And what they found out is that just recently they have had to change these dietary recommendations, because what they found out is that your dietary cholesterol, meaning the cholesterol in what you eat, has little to almost no impact on your blood lipid cholesterol levels. Meaning cutting cholesterol out of the foods you eat has little to no impact on the cholesterol in your bloodstream. Did you guys get that? All right, so that's a big deal. Now, the reason is because almost all of the cholesterol floating around in your bloodstream is produced by your body. So why would your body produce cholesterol? Well, it produces cholesterol in response to inflammation and damage. So you get inflammation, and it damages the smooth lining of your blood vessels, all right? Now, if you get damage to the smooth lining of your blood vessels, your body then sends cholesterol there to try to help, like, patch. It's like a patch in an inner tube. And the cholesterol is sent there to try to patch the damage from inflammation. And basically, you have cholesterol floating around in your bloodstream all the time. If your blood vessels are nice and smooth and everything's good, then guess what? The cholesterol has nothing to stick to. But if there's a ton of inflammation and it causes damage or nicks in the blood vessels in your heart and in your arteries, what ends up happening is that gives the cholesterol a place to stick, and then the cholesterol can build up, then the cholesterol can clog your arteries. So the question is the enemy cholesterol? I don't think so. I mean, cholesterol is actually trying to do something positive for you and help your body repair. What the enemy is the inflammation, right? That's why some more forward-thinking doctors, when they're testing you for the possibility of heart disease, there's this new test called your it's high specificity C-reactive protein. Now, the reason why they want to test that is the HSCRP test, C-reactive protein test, is an inflammatory marker test, and it is predictive of future cardiovascular events. And that's because we know that inflammation, not cholesterol, is what causes the damage and is ultimately what drives heart disease. All right? So, here's a question I have for you. All right? What if there was a natural way, okay? A natural way that was non-addictive, non-toxic, completely natural, no side effects, that could actually have a positive impact in helping people with heart disease before they get to things like pharmaceuticals and all that, but even with them if they have to. Would that be something that you would be interested in knowing about? Well, of course it would. Everybody wants to know that. I want to know about it. So that's what we're going to talk about. So CBD oil is that very thing, all right? CBD oil has a number of positive impacts for things that drive heart disease. And since heart disease is the #1 killer globally, we're going to talk about it, all right? So what is the #1 way that I think that CBD oil has a positive impact in heart disease? Well, what did we just spend a whole bunch of time talking about, right? What ultimately drives cholesterol to stick to your inside of your arteries? Well, it's inflammation. And guess what? One of the best researched and most known positive benefits of CBD oil is that CBD oil has an interaction with your CB2 receptors in your body. And when it has that impact with your CB2 receptors in your body, it helps reduce inflammation. It helps modulate your immune system and reduce inflammation. Now, if you can reduce inflammation, then you're going to have less damage and inflammation of your blood vessels and arteries. And if you have less inflammation, you're going to have less cholesterol sticking to those damaged spots. And if you have less cholesterol sticking to those damaged spots, you're going to have less places where your arteries are going to clog up, less cardiovascular disease, less heart attacks. All right? So, #1 is the way that CBD oil can help with cardiovascular disease or heart disease is that it helps reduce inflammation. And it is probably the most researched thing they know about CBD oil is the impact that it has on inflammation. So, we don't have to go that deep into that. We just know that's the case. We know that's what it does, and that's what's awesome. Now, this is especially important in diabetics. Now, why is that? Well, here's the thing. one of the major secondary complications of being a diabetic is heart attack or heart disease, cardiovascular events, stroke. So why is that? Well, because we know that high blood sugar and high insulin levels create a ton of inflammation. That the high blood sugar can damage the inside of your arteries, and that creates inflammation, and then cholesterol goes there and it can stick, and then you end up with the problems that we're talking about. All right? So this is the whole point. So the point being is that we know that CBD oil can help reduce inflammation, to help reduce cholesterol sticking to your arteries, which helps with heart disease and problems like that. And it's especially important for type 2 diabetics. Now, the second way is that some recent research has shown that CBD oil can help reduce or lower blood pressure. Well, now here's the thing. We know that there's a number of things that can increase your blood pressure. Number one of them is if you got plaquing or things sticking to the inside, atherosclerosis, sticking to the inside of your blood vessels, it reduces, like if this is how big around it normally is and it gets this big around, there's going to be more pressure in there. And so we just said that we know that the anti-inflammatory effect of CBD oil help, maybe we don't stick so much plaque on the inside of those arteries. That's going to help with your blood pressure, all right? But second, we also know things like stressful events, and there's certain hormones and chemicals that are vasoconstrictors, things that make your blood vessels close down, all right? Now, CBD oil has been shown to help lower blood pressure, all right? Because the higher your blood pressure is over time, the harder your heart has to work, and the more likely is that you're going to have a breakdown in how your heart beats and how it works. So helping your body reduce blood pressure is another way in which CBD oil has been shown to help with heart disease, all right? And third, so this is really important because a lot of people are like, well, great. Everything you're talking about sounds like things that might help me prevent having a heart attack or heart disease. But guess what? I already got it. My artery, like I've already had a bypass. I already know that I have arteries that have been partially clogged. I'm at a high risk for heart attack and stroke, and I already know it, and so this isn't for me. It's not going to help. Wait a minute, I got more info. One of the really amazing studies that recently came out, now I believe it's from China, but this is what the research study shows, is it shows that if you're taking CBD oil, when you have a heart attack or when you have a stroke, it reduces the amount of damage that it's caused. All right? So when you have a heart attack, basically there's part of the blood flow is blocked to a certain part of the heart muscle, and that part of the heart muscle dies. It infarcts. That's why it's called a myocardial infarction. It basically, that part of the heart muscle dies when it doesn't get the blood flow. And the same thing happens in a stroke. Well, guess what? They have found out, my office phone is ringing. Probably somebody that needs my help, but I'm helping you right now, so I can't answer it. But I wish I could somehow turn it off, but I can't. So we know that the CBD oil was shown in this study to reduce the size of the infarct, or reduce the size of the damage that was caused by the heart attack or by a stroke. I mean, how awesome is that? So if you're in a high-risk category for somebody that might have a heart attack or a stroke, it's not too late to take CBD oil. Actually, now would be the time to start taking it, because let's say you start taking it and in a month from now, you had a heart attack. Well, guess what? It's going to reduce the size of the amount of damage that happens. Wouldn't that be, I mean, that's awesome, right? It might be the difference between having serious deficit after a heart attack or just a little bit of deficit that you can repair from and come back from. Doesn't that sound awesome? So that's really the whole point. What we want to do is, CBD oil has an amazing ability to help in the areas of heart disease. Number one, it helps reduce inflammation. And we know that inflammation is one of the primary, if not the primary causer of cholesterol sticking and clogging up your arteries. So reducing inflammation is going to have a huge and positive impact. Number two, we know that CBD oil has been shown to help reduce blood pressure. And we know that high blood pressure over time, it's not good for your heart. That's why everybody and their brother is on high blood pressure medications because the doctors do not want you to have high blood pressure because they know the negative impact it has on your heart and the problems it causes with heart disease. And then 3 is if you are already in a high risk category for having a heart disease or a stroke or some type of cardiovascular event, if you already know you're there, you're already on blood pressure medications, you're on cholesterol medications, and your C-reactive protein is through the roof, and you're like, I don't know, I could have a heart attack any day, well then absolutely you want to be taking CBD oil, because by having CBD oil, it can help reduce the damage caused by an event. A myocardial infarction or a stroke. It will reduce the size of the damage. That is awesome. And I know that's what all of you want. That's what I want for you. Now, here's the thing. If you would like more information about the CBD oil that I recommend, all right, then this is what I want you to do. Don't put it in the comments, all right? What I would love for you to do is direct message me. Okay, if you put it in the comments, man, Facebook is all over the place. It's changed my face. I don't even know how to read it half the time. So please send it, direct message me, and I will tell you exactly what to order, and I will send you my link and you can get it. Now, if someone else sent you this video, please get back with them and they can send you probably the same link, okay, from them, all right? Also, so definitely message me and I will get you the CBD that I recommend. Number 2, if you would like to help other people get these kind of benefits by being in the CBD oil business or by being an affiliate for a CBD oil company, then I would like you to be on my team. I am looking for 4 people, all right? 4 people. That's it. Then if I get 4 people, I am going to help you in this business. You will be on my team. We're going to grow this thing. It's going to be great. We're going to help a lot of people. It's changing lives everywhere, both with the CBD oil and through the business financially. So I would love to help you. If you want to be on my team, if you'd like to get into the CBD oil business, then direct message me as well. I am definitely excited to help you. Now, if someone else sent you this video and you want to be on their team, be on their team. All right? But the most important thing is let's work together and let's change some lives. We can do a lot of things. Now, here's the deal. I also know this. I am not naive enough to believe that you can do everything wrong in your lifestyle. You can eat sugar like it's going out of style and tons of inflammatory foods and products, and you can smoke and you can drink and you can sit on the couch all day, and that if you just take CBD oil, you're going to magically avoid all of the problems of cardiovascular disease. It's probably not going to happen, right? Sounds awesome, would be cool, not going to happen. So that is the reason why I took an all-inclusive approach and I created the world's first online health transformation program featuring CBD oil. No one else has ever created a wellness health transformation program with CBD oil as a center part of it. I did that, all right? And the reason I did it is because of all the reasons I just told you about why CBD oil is important. I married that with an eating style and a diet that is anti-inflammatory, that will help you lower your blood pressure, help you lose weight, help with your heart disease. Not that we're treating any conditions, once again, but it will help in a lot of the areas that drive it. And then there's other specific supplements in addition to CBD oil that will help you both lose weight and get your body in balance and reduce your blood sugar and reduce your inflammation and reduce your blood pressure. So if you would like that type of additional help, more so than just this video or more so than just taking CBD oil, then this is what I want you to do. This is the thing. I want you to put yes in the comments. Now, what should happen is you should then get a message in Messenger saying, hey, learn about the plan. But guess what? This automated message bot stuff has been so screwed up that I bet people have put in yes a million times and not gotten any response. So if you put in yes and you do not get a response, please direct message me and I will send you the link like manually from me. But man, it's been so inconsistent. I have absolutely no idea if people have said yes before and they haven't gotten the link. I apologize, but this automation stuff is driving my wife and I mucho loco. All right, so yeah, and when we send you the message in the message bot, it's going to ask you to say yes again because it wants to make sure you're not a robot. All right? So please put that, say yes in the comments. If you get, it'll send you a message in Messenger, then put yes again, because this program can change lives. Now listen, it's going to send you to a place where there's a video of me describing how the program works, and if you're interested in it, please get it. It is the most comprehensive, cheapest program you will ever have to be able to make a radical shift in your health right now. It is the exact same information that people come to my office, meet with me personally, and we make radical shifts in their health, and they pay me a lot of money to do it, and they get a lot of interaction. And guess what? I took all that information and I put it in videos just like this one, all laid out for you so that you can follow step by step. CBD oil, and if you already take CBD oil, that's awesome. That's just a third of the program. But then it's going to add in the eating style and the diet and the supplements, and you put all three together, life-changing. It's awesome stuff. So, CBD oil has an amazing impact for heart disease. It can help reduce inflammation, reduce blood pressure, and it reduces the damage caused by a myocardial infarction or a stroke, which are all reasons to take it. I highly encourage you to take it. If you want to take it, direct message me, and I will tell you the oil that I recommend. If you want to be on my team, also direct message me and say, hey, I want to be on your team. And then definitely, if you would like the program to radically change your health online, it's amazing. Put yes in the comments. If you don't get a response, then please direct message me and I will help you with it. All right? So, just like I tell my son every day before he goes to school, be your very best today. Hashtag never quit. And I believe that God wants the very, very best for you. And the day you believe that, change your life forever. Have an awesome, awesome night.